This is an ultrasound study of 23 years old female student presenting with the history of hematuria. This is the right kidney, which is showing normalcy. This is the right kidney, nothing wrong. Now I'm going to straight away go to the left kidney. This is the spleen in front of you. Now left diaphragm, the spleen normal in diameter. Now this is the left kidney. Lower pole and mid region are being focused. At present I am focusing the lower pole and the mid region of the kidney. Now this is the lower pole, this is the mid region. Parent cortex is normal, medullary region is normal. In this case, these are the medulla. The central sinus echo-complex are normal. Metameridian covered. And the thickness of the parenchyma is normal at the lower pole and at the mid region. Remember that this is the lower pole and this is the mid region of the left kidney. We are seeing the left kidney, and this is the iliopsoas muscle on which the kidney is gliding. Now if you see, there is a cystic structure, tubular structure rather, seen posterior to the kidney, upper pole of the kidney, and as you can see, it's difficult to, because of the pressure effect from this cystic area, the upper pole is slightly pressed anteriorly. Now this is the upper pole of the left kidney, and this is the cystic area. This is the iliopsoas muscle, left iliopsoas muscle. This is the cystic area, well demarcated, thin walled, and this is the parenchyma, that of the upper pole of this kidney. Right, left kidney, these are the pyramids, central sinus echo-complex. Now this is a very special case in a sense that you will see that the cystic area that is pressing mainly the anterior pole is tubular in structure and approximately measures 10.3 centimeters in length and 5.2 centimeters in anterior posterior diameter. It has, now at the upper region it shows blunt, and it does not communicate with any other structure. Here you see, here it is. Now here we can see three structures together. One, this is the tubular cystic area that I am talking about, thin walled, and it has blunt ending at just above the upper pole of the kidney. Now this is part of the upper pole of the left kidney, and this is the spleen. The spleen part of the left kidney, and this is the dilated cystic structure seen posterior to the and pressing the upper pole of the left kidney, and then it is coursing posterior medially, and you will see that it does not relate to the iliopsoas muscle. Iliopsoas muscle, it can be seen posterior to it, and here now you see that. Just a minute. This is the tubular area, cystic area. It narrows gradually laterally, and then it becomes continuous with another tubular structure, which is the ureter. And the ureter, it can be traced. You see that This is now, see, this is the lower pole of the left kidney. This is the iliopsoas muscle, and now this is the ureter. Whole length of the ureter is traceable from the now in fact what the situation is that there is a cystic area extending from the posterior surface of the, just above the posterior surface of the left kidney. Now this is the cystic area that we saw initially, and it then communicates with this tubular structure which is the ureter. And the ureter is dilated up to approximately 11.8, and this is this tubular area that we initially saw that is coursing posterior to the kidney and is representative of dilated pelvis. Now this is a case of ectopic insertion of the ureter into the kidney. So now this being the same structure that I informed you, this is the iliopsoas muscle. This area, this is total iliopsoas muscle. It does not relate, the cystic area does not relate to the iliopsoas muscle either. And in this section, the traceable length of the ureter is approximately 6.27 centimeters. Now let's trace the ureter, and now this is the total length of the ureter, starting from, again I am going to show you from the kidney, and from here. Now here I am tracing the total length of the ureter. This is the total length of the ureter, going upwards, showing you its relation with the kidney. And if you note, we do not see any peristaltic movement in this. I have magnified the view. No peristaltic movement is seen or is seen. Let's see. This is not the peristaltic movement that of the ureter by itself. It is because of the pressure of the bowels on the thin wall of the dilated ureter. Now here the ureter is dilated up to 14.6 millimeters. So this is quite a significant dilation. Left ureter. Okay. Now why this, or what we are seeing is, why we are seeing all this is because of very rare pathology that will be in front of you. Just wait. Now this is the area, ureterocele, that we call it. You see, we see a well demarcated thin wall cystic area, and the another one alongside. This is the larger one, this is the smaller one, and it measures approximately the larger one measures 32 by 24 millimeters, and the smaller one measures approximately 17.7 by 16.4 centimeters. And this is the urinary bladder. This is the urinary bladder, and this cystic area is a part of this cystic area, and this is in fact dilated, and it is the ureterocele that we are seeing, or the dilated ureter in this region. It is at the uretrovesical junction, left uretrovesical junction, and this is the cause of hydroureter as well as dilated pelvis. But it's not because, but there is no hydronephrosis seen. The reason being that there is ectopic insertion of the ureter in the urinary bladder. Sorry, in the kidney. Now let's see this. Follow this cystic area, and you can see this is the distal ureter. It is full of echoes, which is possibly a bleed or pus, and this is the thin walled cystic area, the ureterocele, and this is the ureter dilated up to 12.1, distal ureter, and this is the ureterocele extending from the insertion of the ureter, left ureter into the ureter. So I will label it as C. C means cystocele. This is the urinary bladder. This is the urinary bladder. Okay. Now the एक मिनट होल्ड करो. Now if we see in a mute figure, you see that the uterus is normal, the urinary bladder is overfilled, and this is the ureter in longitudinal section. फिर करेगा फिर बंद कर देगा. This is the ureter, the uterus in longitudinal section, urinary bladder in longitudinal section. This is the part of the ureterocele that you are seeing. Here we see the left ovary. This is the left ovary, this area. This is the left ovary. You are seeing developing follicles in it. And मैं कह रहा बंद कर दो. This is the right ovary. This is the right ovary. So the both ovaries are normal. The left ovary is showing follicular activity, is the dominant ovary in this cycle. So this is our case of the day, in a sense that again I will show you. This is the dilated ureter full of echoes, pus or bleed. This is the ureterocele. Now actually this ureterocele measures. This is the measurement of the ureterocele, and this is the dilated distal ureter, left sided, which is entering the urinary bladder. This is the ureter. So this is the urinary bladder, and this is the cystocele. And so this is our case of the day, that is the ectopic insertion of the left ureter into the kidney with dilated pelvis. This is the dilated pelvis, and this is the dilated ureter, a peristaltic opening, and here it opens into the here it's opening into the urinary bladder with no movement seen in it, and the ureterocele that is in front of you. Thank you very much.